Thank you and welcome back to this final segment of the show for today. We're talking to Dr. CPoe, and the topic is the relationship between religion and health. Dr. Poe, you know, I think you've given us excellent information dealing with the relationship between religion and health. But now, what about some of those individuals who are somehow bullheaded, quote, enough not to be willing to believe of this relationship? And also, is this relationship as new as we seem to think that the relationship is? Talk about it from that perspective.
Well, no, it's not. There are, at last, based on Dr. Koenig at Duke's comments at a conference that I mentioned earlier, he indicates that about 5% of our nation's physicians have begun to address the spiritual needs of their patients. That's a very, very small percentage. And so we're not really giving adequate attention to this particular area. Now, Freud, for example, who wrote and who spoke between about 1904 and to 1939 when he died, was very critical of religion. As a matter of fact, took the position that God was a figment of people's imagination. So there's been this division between psychiatry, modern psychiatry, and religion that goes back probably 300 or 400 years. That's beginning to show some signs of falling now, but we still have a long, long way to go. At last count, there are about 14 psychiatric residences that offer courses or instruction to their residents in psychiatry in the area of spirituality and mental health. Now, if we go back, though, before 600 years ago, we discover that the church or religion and medicine were interlocked. The church established most of the hospitals before the 16th century. Most of the nurses were from religious orders, such as the Sisters of Charity and the deaconesses. And so this was true going back to about 307. As a matter of fact, the first hospital in the West was started in a place called Caesarea, Turkey, by the Eastern Orthodox Church. This was in 370 AD. And for 1,200 years after that, the church and medicine basically were integrated. They were interlocked. As a matter of fact, in the West and most ancient cultures, the physician also was a minister. Okay? As a matter of fact, in the first 100 years of the history of this country, most of our doctors were ministers first, and the medicine part was practiced as a sideline to help supplement their income. So it's only been in the last 300 or 400 years that medicine and religion and health have become separated. As I said before, now there's some signs of them coming back together. So in my case, for example, I'm a physician or psychiatrist, I'm also a minister, but that was not unique 600 years ago, because the minister and the physician were one and the same person, okay? So then encouraging people to pray, which I've done now for the last 25 years, encouraging them to go to church, encouraging them to put their faith and trust in God, encouraging them to move away from a self-centered lifestyle to a Christ-centered lifestyle is not really new. It's just new in the minds of most patients and most of those persons in the healthcare field over the last 300 or 400 years, but that was not new. Traditionally, the minister and the physician were one and the same person.
You know, one of the things, Dr.